Here's 5 quick questions to test your clinical knowledge, all right? Remember, pause the video if you need more time to think the questions through. Leave your results in the comment section, all right? Let's go. Question 1. The nurse is caring for 4 clients on a med-surg unit. Which client should the nurse assess first? Okay, guys, so the answer is C. The client 1 day post-op thyroidectomy who has muscle twitches and a positive Schroff-Stek sign, okay? So you got to think about stable versus unstable, right? The facial twitching after thyroidectomy is an unexpected finding that suggests hypocalcemia and is related to possible parathyroid involvement during surgery. So severe hypocalcemia can progress to laryngospasms and airway compromise, making this the priority client, all right? Question 2. The nurse on the medical floor receives report on 4 clients. Which client should the nurse see first? Remember, these are prioritization questions, okay? So guys, so the answer is A. The client with a new lower extremity plaster cast who reports a tight, burning feeling and tingling in their toes. You want to think about expected versus unexpected signs and symptoms, okay? Burning and tingling under a fresh cast are unexpected critical signs of compartment syndrome. This is an acute surgical emergency where swelling compromises circulation and tissue perfusion. Question 3. The nurse is preparing to make rounds on 4 clients. Which client requires immediate intervention? Guys, so the answer is B. The client with pneumonia who became acutely confused, restless and agitated this morning, all right? So you want to think about acute versus chronic. A sudden acute change in mental status is a red flag. Restlessness, agitation, and confusion are some of the earliest signs of hypoxia, meaning the brain may not be getting enough oxygen, okay? So this makes the client highly unstable, and it makes them the priority patient to see, okay? Question 4. Which clinical task is most appropriate for the charge nurse to delegate to an experienced, licensed, practical nurse, which is an LPN? Guys, the answer is C. Performing tracheostomy care and suctioning on a client who's clinically stable. So you want to once again think about stable versus unstable. LPNs can care for stable clients with predictable outcomes, right? Tracheostomy care and suctioning for a clinically stable client is within the LPN scope of practice. Think about the delegation rules. All right, question 5. The nurse is caring for a client who is 1 day post-op. Which task is most appropriate to delegate to the unlicensed assistive personnel, which is a UAP? Guys, so the answer is D. Collecting a routine clean catch urine specimen from a client who is stable and mobile. Again, stable versus unstable, right? Collecting a routine urine specimen from a stable and mobile client requires no nursing judgment, making it an appropriate task for the UAP. First-time ambulation after surgery is unpredictable and requires nursing judgment. Neurovascular checks involve assessment skills, and feeding a client on aspiration precautions carries a choking risk and requires close nursing interventions. Y'all, that's it for this video. I want to thank you for watching and participating. Please remember to leave your scores in the comment section. And listen, I'm going to always leave you with this. Never dim your light for anyone. Stay lit.